Hello and welcome to my presentation for Health Promotion Principles and Practice. So health promotion has made significant leaps since the Declaration of Alma Ata in 1986 when the Ottawa Charter was declared. However, what was written in the Ottawa Charter still holds relevance today around the world and still remains the basis of many health promotion activities, such as the ones I will be speaking to you today about. While there are several approaches to health promotion, such as community development, healthy public policy and activism, the approach that I will be focusing on today is the settings approach. While on the outset, the settings approach may seem simple, it is far from it. This approach has been recognised for quite some time for its importance in health and was highlighted in the Ottawa Charter as health is created and lived by people within the settings of their everyday life, where they learn, work, play and love. According to the World Health Organization, healthy settings should maximise disease prevention via a whole system approach. Some examples of healthy settings include, but are not limited to, towns, cities, schools, universities, hospitals and care facilities, prisons and workplaces. The importance of settings was also affirmed in the Ottawa Charter, which stated that each person must learn how to cope with injury and illness throughout their lives, and this should be done through a variety of settings. Mark Douris noted that the settings approach is underpinned by a number of values, which include partnership, participation and equity, all holding importance when planning and implementing programs. Partnership can be between both the health promotion practitioner and populations, or between governmental departments where appropriate. Participation means that those in the population are able to utilise the program and feel that it is beneficial to their lives and health. And equity allows those populations that may require more resources or programming to have them without discrimination. An important skill for health promotion practitioners will be to understand these values and incorporate them effectively into health promotion programs. Sandy Whitelaw, a prominent settings-based researcher, in 2001 outlined 5 types of health promotion models in the settings approach. These are passive, where the problem and solution lie with an individual's behaviour. This model allows for the setting to be a place where individuals are able to access a program, for example, health counselling services. An active model, where the problem is due to an individual's behaviour and in part the solution lies with the setting. This model uses the setting as one of the resources in the program and not just an access point for individuals. Vehicle, where the problem lies within the setting and the solution is down to the learning of individuals. This model focuses on policy development and bringing about structural change, but also focuses on individual education. Organic, where the problem is due to the setting and the solution is through the individual. This model uses community development and participation to improve health outcomes in populations. And the comprehensive or structural model, the problem and the solution are due to the setting. This model is used to create structural change and uses policy as one way to do this. And as such, it is similar to the vehicle model, however, does not focus on individual education. There are a number of different healthy settings examples that draw on different settings. One of the landmark health promotion projects in this area is Healthy Cities. Healthy Cities was first introduced to the world in 1986 to tackle the rising populations in urban areas around the world. This program allowed governments to make commitments to their cities to see that their development would be sustainable well into the future and a healthy and safe place to live. When Healthy Cities was brought to Australia, 3 cities were trialled, including Canberra and the Illawarra region. And the Illawarra region still remains a healthy city and is probably one of the best known in Australia. The use of settings in health promotion is often used in conjunction with other health promotion approaches. In the case of Healthy Cities, the health in all policies is one of the most important approaches in this instance, as well as community development as well. The World Health Organization once again affirmed at the 9th Global Conference for Health Promotion in Shanghai last year that there must be strong leadership, and that includes representation from health, urban planning, housing, sanitation, environment and/or transport. Collaboration is highly important when implementing programs through the settings approach, and can be both a challenge and an opportunity for health promotion practitioners. This is something that I'll be discussing later in the presentation. Some other notable health promotion programs using the settings approach are the controversial needle and syringe programs used in prisons throughout the world. Needle and syringe programs are implemented in an attempt to prevent diseases such as hepatitis C and HIV, which can be transmitted via shared needles. In 2016, the number of prisons that used a needle and syringe program was a mere 60 out of more than 10,000 prisons around the world. Another highly successful settings-based approach program is the school breakfast program that allows children to access healthy and nutritious foods where they may once not have been able to. As well as this, they allow children to create healthy habits that should last well beyond their schooling life. One such program is the Western Australia Food Bank School Breakfast Program, which currently serves more than 15,000 breakfasts a week. It has been growing for the past 15 years. These are just a few of the health promotion programs that make use of the settings approach. There is no one setting that is more important than another, as different settings will play different roles throughout a person's life, and in many ways, each person's experience of one setting will not be the same as the next individual's. Well, there are many case studies that use the settings approach, like the ones I just spoke to you about. The case study I'll present to you today uses the workplace as its setting to promote health. This particular program is focused on the building industry. So firstly, some background information into the state of health in the construction industry. There are several health issues that face the construction industry, notably a higher rate of suicide in comparison to other industries. Substance abuse is also of concern. A 2014 report conducted by PricewaterhouseCoopers for Beyond Blue found that approximately 13% of workers abuse substances, including both illegal drugs and legal drugs such as alcohol, the highest of any industry. Another concerning statistic is that the rate of suicide among construction workers is almost twice as high as the rest of the population, meaning tradies are twice as likely to commit suicide, as you can see in the figure there. When broken down further into states, nowhere is the rate of suicide higher than in the ACT, where tradies were 3 times as likely to lose their life to suicide. To address this, several organisations have introduced programs that directly target the health of tradies, both mental and physical. One of these organisations is Mates in Construction. Mates in Construction has several offices around Australia and a helpline for those in need, regardless of their location. A program that Mates in Construction implements is Peer Connectors. These are workers on job sites that are trained in suicide prevention to recognise signs, and if their fellow workers need help, point in the right direction. This program is highly successful as it allows workers to speak to someone they're familiar with or they may even know, and allows them to speak to someone face to face rather than someone they've never met before or on a helpline. So it's one of the most successful programs that Mates in Construction has. It has also been reported that the industry has seen a decrease in suicide rates where Mates in Construction has been able to implement their programs. However, they currently do not have an office in the ACT, which may in part be able to explain why the ACT has a statistically significant difference in suicide rates. An equivalent organisation to Mates in Construction in the ACT is AusHelp. AusHelp provides suicide prevention training as well as general health checkups known as tradie tune-ups that are available to all in the construction industry. These focus on both mental health as well as physical health, which is still just as important. Its founders were motivated to improve the health of tradies in the ACT after their son lost his life to suicide. However, one particular grassroots program that aims to improve the health of tradies is the Healthy Tradie program, established right here in Canberra. The Healthy Tradie project was established by Philippa Selden, a construction project manager at a local building company, to help tradesmen become healthier through a holistic approach to health and to keep them doing what they love for longer. Philippa designed this program after she lost her brother to suicide in 2009. He was a carpenter. Her other brother is an electrician. Her experiences in the industry, having been in there for almost 20 years, as well as her siblings, means she understands the population more than most. The settings model that is being used in this instance is an organic model, as in part the problem in this instance, the health of tradies, is partly due to this setting, and the solution is up to the individuals and the action they take. In this case, the individuals are not only the employees, but also the employers, and how they choose to use the program. When I spoke to Philippa, she spoke about work health and safety, where there is a huge emphasis on safety in the construction industry, which is obviously very important. However, health has been left behind. I'm sure every one of us has seen or read at least one news report on the safety issues within a construction work site and the lengths a union will go to rectify this issue. However, how many of us were aware of the health issues facing tradies? The initial implementation of the Healthy Tradie project was supported by 5 building organisations throughout Canberra. These were PBS Building, Mantina, Shaw Building Group, the Block Group and Construction Control, all of which are large organisations and also have subcontractors, which adds to the amount of people that they are responsible for on the work site. So the launch of the Healthy Tradie project was in Mental Health Week of October last year. These 5 building companies enforced a stop work period of around half an hour so that those on the work site could engage in activities such as yoga, which was adapted so that those in steel cap boots could do the moves effectively, mindfulness exercises such as meditation, and some nutrition tips. When I asked Philippa had she encountered any challenges implementing the program, she said that the companies she approached, as the ones you saw on the slide previous, embraced the program as they saw its importance. However, she is now encountering the challenge of encouraging employers to continue their commitment to their employees' health. Stop work period comes with lost man hours, which can add more stress to both employees and employers, and is something she hopes to overcome. She's also hoping to develop a handbook so that participants have a guide at home for nutrition, mindfulness, and strategies for mental health. This is already in addition to her online program that tradies can sign up to individually or as a whole workplace. Philippa also hopes to branch out into yoga that is designed for tradesmen at times at work for them in environments that are comfortable and welcoming. One of her target demographics for this is apprentices. She hopes to encourage them to make healthy choices from the outset of their career and neglect the stereotypical tradie that is a macho man who eats unhealthy foods, who isn't afraid of a drink after work. This macho image has been ingrained within the construction industry and also encourages men to help their friends and family but not speak up when they need help themselves. Participation is an incredibly important value that underpins the program, as without participation it would not be implemented. While initially Philippa designed the program from what she had seen and researched, she is now beginning to use the feedback of those who have participated in the program to develop it further and become a more collaborative effort from the population and herself. This will enable the program to be tailored to the needs of tradies directly and potentially appeal to them and encourage them to participate for longer periods of time. From Philippa's experiences visiting work sites, she has found that no one demographic was more reluctant to participate than another. She spoke of positive peer pressure, where tradies would be encouraged by their fellow workers to participate, as they didn't want to be seen as the only ones not participating. Philippa does acknowledge that this program may not be for everyone, but she does hope that those who the program doesn't appeal to will still see the importance of their health and take their own action. This program is designed to give workers a foundation to pursue their own health goals and begin to understand where they can make interventions in their own lives, even when they aren't at work. It is designed to be a basic overview, though still very important, similar to a building foundation, an analogy she uses. The foundation allows tradies to gain a better idea of their health, as well as providing the tools to understand signs of poor health, whether that be physical or mental, and where to seek help should they need it. One of the aspects of the Healthy Tradie project is the wheel. This provides a visual representation of several aspects of a person's life. It also gives tradies a tool to appraise their own lives, how well they are living it, and where improvements can be made. This aid appeals to kinesthetic and spatial learners, which is something that many tradies are due to the hands-on nature of their job. The wheel reflects the social determinants of health. For instance, food and stress are part of the wheel under the umbrella of the work environment. This allows tradies to connect the dots and understand how one aspect of their lives, no matter how small, can affect countless other facets of their lives and significantly impact their health. At this stage, it is too early to conduct an evaluation of the Healthy Tradie project and its success. However, the impact that it has made on the Canberra building industry is beginning to be felt and has not gone unnoticed by the community. Philippa had the opportunity to present a TED Talk to the Canberra community last year, as well as numerous news outlets acknowledging the importance. Mates in Construction have also acknowledged the importance of Philippa's project, and she was able to present at a recent conference in Sydney. The Healthy Tradie project is an example of a grassroots project that uses the workplace setting to involve the lives of the population in a meaningful way. While the project is still young, it shows promise by using the values mentioned by Douros and has the interests of the population at its forefront. There are a number of challenges that health promotion practitioners should be prepared to face. However, there are also many opportunities that come with it. The population that is being targeted, be it a workplace, a school, prison, regardless of the setting, it must be a collaborative effort between the practitioner and the population being targeted. It may be a challenge to engage these populations in ways that appeal to them that can also improve their health. As a primary value that the settings approach rests on is partnership, it is important that health promotion practitioners develop good people skills, as interaction between them and members of communities is a vital in the planning process. Being able to develop the trust of community members may be a challenge, especially towards those who are often marginalised, including populations such as migrants who may be distrustful. It may be a challenge for health promoters to accept that not every program will appeal to each person within the setting, and that there will always be people that fall through the cracks. However, to look at this the opposite way, it is an opportunity for health practitioners to encourage populations to take ownership of their health and contribute to programs. This is an opportunity for health promotion practitioners to work collaboratively with members of the community and learn skills from those they may not usually interact with. A challenge for health promotion practitioners that Whitelaw cites is that programs and projects need to be sustainable past the initial implementation and make projects meaningful to those in the settings and endeavour to impact the health of a population in a positive way. With this challenge, it is that health promotion practitioners may find themselves in the crosshairs of bureaucracy, where the interests of politicians come before those in the population. This may limit how sustainable programs can be, as in some cases funding may be limited or cut, impacting how resources can be allocated. Being able to adapt will be a challenge for health promoters. However, again, it can also be an opportunity to develop skills. Similarly, another challenge for health promoters is the settings approach may deal with a lack of resources to implement programs. The use of the settings approach can be on a large scale, like Healthy Cities, or grassroots, like the Healthy Tradie Project. International and local programs that use the settings approach can have significant impacts on the health and lives of populations. The use of settings can not only improve the lives of those already within the population, but the setting itself, and become a healthier setting for years to come. Working collaboratively is an important element of settings work, regardless of whether this is with members of the community or other governmental departments, and highlights an important skill for health promotion practitioners wanting to use the settings approach. Using settings presents an opportunity for those involved and will no doubt be used by health promotion practitioners well into the future. Thanks very much.